are advanced imaging techniques used to diagnose psoriasis. Imagine a world where doctors can see inside your skin without cutting or biopsying. That's what advanced imaging techniques are helping us do when it comes to psoriasis. These methods are becoming more common for helping doctors understand and monitor this skin condition. They provide detailed pictures of the skin's structure and blood flow, which can improve how we diagnose and treat psoriasis. But it's important to remember that these imaging tools are used alongside traditional clinical exams, not as a replacement. One popular technique is dermoscopy, also called videodermoscopy. It uses magnification to look closely at the surface of psoriatic lesions. This helps doctors see specific features like the pattern of blood vessels and the color of scales. Videodermoscopy offers even more detail and can help differentiate psoriasis from other skin conditions that look similar. High-frequency ultrasound is another tool that gives high-resolution images of the skin layers. It can measure how thick the skin is and show signs of inflammation, which is useful for tracking how well treatment is working over time. Reflectance confocal microscopy allows doctors to look at the skin at a near-cellular level in real time. This helps study how inflammation and tissue changes happen in psoriasis. It can guide treatment choices and deepen understanding of how the disease progresses. Optical coherence tomography, or OCTOBR, provides cross-sectional images of the skin, showing details of the epidermis and dermis. It helps assess changes in skin structure that are typical of psoriasis. Blood flow and tiny blood vessel changes are important indicators of disease activity. Techniques like laser Doppler imaging and optical microangiography measure blood circulation within psoriatic plaques. These can help determine how active the disease is. Fluorescence optical imaging uses special contrast agents that glow under certain light to detect increased blood vessel growth in inflamed tissues. It's especially helpful for spotting early inflammation, including in joints, which can help distinguish psoriasis from psoriatic arthritis. Emerging technologies are also on the horizon. Multispectral optoacoustic tomography combines ultrasound with light-based imaging to measure molecules involved in inflammation, like hemoglobin and oxygen levels. Artificial intelligence is being explored to analyze imaging data, which could someday help predict how psoriasis will develop or respond to treatment. While some of these techniques, like dermoscopy and ultrasound, are already used in everyday dermatology clinics, others are still being researched. They all aim to give doctors more objective, measurable information about the skin and blood flow. This can help catch psoriasis early, tell it apart from other skin conditions, monitor how well treatments are working, and even predict if the disease might progress to involve the joints. It's important to remember that imaging is just one part of the diagnosis. Healthcare professionals will always consider your full medical history, symptoms, and sometimes perform a skin biopsy if needed. These advanced tools are promising and help personalize care, but they are meant to support, not replace, traditional clinical evaluation. If you think you might have psoriasis or want to understand your condition better, always consult a healthcare provider for a proper diagnosis and tailored treatment plan.